GenesisCare is committed to providing exceptional cancer treatment to give their patients the best possible life's outcomes. And here with more is Dr. Dwight Fitch, radiation oncologist. Welcome back.
Thank you.
We're going to be talking about another very serious form of cancer today, lung cancer.
Yes.
So can we start with what are the symptoms? What should people be aware of, doctor?
Gotcha. So with lung cancer, one of the greatest difficulties is that if it's an early stage, you can't actually feel anything. You know, some of the symptoms that you will notice though, coughing up blood, shortness of breath you didn't have before, unexpected weight loss, unexplained weight loss, a persistent or productive cough that, again, not responsive to antibiotics or that sort of thing. Unfortunately, like I said, if you have those symptoms, sometimes it means it has progressed past a stage 1 or stage 2.
Okay. Now, what if somebody has a prolonged, say, sore throat? Is that something they should be?
Prolonged sore throat, I would say that if it's not responding to, like, you know, over-the-counter meds, or if you've already seen your doctor and not responding to antibiotics, get checked out. Sore throat isn't usually related to a lung cancer, more so a head and neck cancer, which is also important. So if you have a sore throat that has not gotten better, persists, especially if associated with voice hoarseness or changes in your voice, definitely important to get that checked out and evaluated.
Okay, great. Good. So screening recommendations. I mean, is it something, a regular screening people should get and not wait until there's symptoms? I mean, what do you suggest?
Yeah, you know, so with lung cancer screening, there was a big shift in 2015, this really large study that came out that showed that if you screen a certain population of patients with low-dose CAT scans annually, which means once a year, there was a 15 to 20% reduction in mortality. So what that means is that historically we always did chest x-rays, but they're not sensitive enough to actually pick up all the cancer you might find. So if you screen people between 50 and 80 years old who have at least a 20-pack year history of tobacco use, that means that they either smoked a pack a day for 20 years or 2 packs a day for 10 years. In that population of people, an annual CAT scan has been shown to pick up enough small lung cancers that aren't symptomatic to cut the death rate by about 20%. So it's super important to do that.
Preventative care again,
Preventative
like
care.
with so many other things.
Exactly.
Are there other causes of lung cancer other than smoking, which you just mentioned? Yeah,
you know, if you look at all comers for lung cancer, about 90% of them are either caused directly by smoking or by secondhand smoke. So there's about 10% of people who, you know, just have enough exposure to other outside chemicals you can't really trace, or honestly just bad luck, who also develop lung cancers. But again, the vast majority are related to tobacco use.
Okay. Now, the e-cigarettes and vaping, safer, not safer than smoking, and could that be considered secondhand smoke?
Right. Great question, because, you know, you'll see all these commercials where you can get them everywhere. I mean, kids are using them, adults are using them. The truth of the matter is there's not enough data out to show that e-cigarettes or vaping is safe. Now, most people believe that it may not be as bad as smoking cigarettes. We all agree with that. But it's also not as safe as not smoking. So it falls somewhere in the middle. So what we usually try to recommend to people is not to use those either, particularly young people, because it's really just hooking another generation on nicotine. And we also don't really know what's being released with the vape in terms of the metals that the vape pens are made out of. There's not enough data to know whether it's truly safe. It may not even be just lung cancer, you know, lung injury. There was a ratio of about 60 deaths associated with vaping earlier this year.
Okay, well, there's obviously a lot of products out there to help you quit smoking.
Yeah.
What do you recommend for someone who's trying to quit?
Right.
Possibly their parents are smoking. I mean, what's the least path of resistance for them? Because we know it's not easy.
It's tough.
You know?
It's tough. I mean, to put it in perspective, the addiction potential for nicotine has been thought to be higher than heroin, morphine, cocaine. So nicotine's rough. You know, it's really rough to get off of it. So the best thing to do up front is to be honest with yourself and be ready to make that commitment. Because if you're not ready, you won't really quit.
Exactly.
The things you can do though when you're ready, the Nicoderm patches, the gums, hypnosis, meditation, exercise. These are all things that have been shown to help, but the main thing, honestly, is making that decision. Once you make that decision, talk to your doctor. Florida has a 1-800 I quit line, I think, for tobacco abuse. So a lot of different avenues to help, and if none of those things help, they even have pills like Shantex, which help centrally to help you decrease your urges as well.
Wonderful. Great. So there's a lot of things out there
a lot
that
of
people
ways
can try and get help.
Yep.
Now, in your line of business, what are some of the treatments that there are for lung cancer?
Gotcha. So the main treatments would be either surgery, chemotherapy, or radiation. Preferably, you want to be able to catch these cancers when they're early, stage 1, stage 2, because surgery is really the best treatment for that particular stage and the most curative. If you look at all comers for lung cancer, the overall survival rate is poor because a lot of people have advanced disease when we find them. But the survival rate for a stage 1 lung cancer is about 75 to 80%, which is really high.
That's great.
You know, so in those patients, surgery, either by robotic or take out the whole lobe. And for patients who have not the best medical status, they can have radiation. And for some people, it's equivalent survival without even having surgery.
Okay. So is that what you would consider the non-invasive would be the...
Exactly, exactly. So one of the more common things we're doing nowadays is called radiosurgery. So radiosurgery is an actual surgery with blades, but it's highly precise, highly focused, high energy radiation delivered over as few as 5 treatments just to the tumor. And you get control rates that are equivalent to surgery without hospitalization, without causing bleeding and infection and those things. Now, it's not for every patient, but for those patients that qualify, it's a great, great, great alternative for a lot of people who used to didn't have any alternatives at all.
Wonderful, wonderful. And where can our viewers go to find you?
Type in Dr. Dwight Fitch, GenesisCare, Bradenton, or Sarasota. We're there to help. We're there to, you know, screen, prevent these cancers, and then treat them if we find them.
Great. Thank you again for being with us, Doctor.
My pleasure. Thank you so much.
Coming up after the break, we learn how Inspired Living is taking care of moms and dads during the holiday season.